For Vernon-Monashee.
Thank you, Honorable Speaker, and welcome. It is an honor to work with many amazing women in our government's caucus who work hard to support our government's work to invest in women's health care. And I'm glad that now opposition is also talking about childcare, because before there was a disconnect understanding health and the factors, contributing factors of impacting health, social determinants of health. Music to my ear, finally hearing about childcare when there is a proof that in 2017 and 2020, when I ran provincially, both opposition candidates of the time, one at the CBC, recorded interview, one during all candidates debate, said childcare is not even possible when I was speaking for childcare and our government's plan. So it's good to that tides are shifting. So our government continues to make impactful investments in healthcare in general and with focus to address the inequities in BC's healthcare system, as well as to promote gender equity. As highlighted, spoken by many of my colleagues, I want to share some of the investments as we're also making investments, but I want to share one quote by a senior in my constituency, Lila. She sent me a reply to one of the emails I sent to help her. She said, I quote, "Thank you, well done for accurate information. I was put on a wait list with primary care clinic, was given name by IHA social worker, and I met with nurse practitioner who is now my medical person. All this in December. This thrill of a lifetime is giving my friend the same name. She called, got taken in right away, and double exclamation mark. I used walk-in clinic for several years, brought my records to my new doctor, who was delighted. It was stressful being renovated, threatened, and with homelessness. And God bless Leslie McCullough. I am at $900, not $1,300. So she talks about the senior housing second phase that we supported in Vernon-Monashee. Bless the government that believes in people. I was finally able to get my teeth fixed. I support the NDP with much gratitude, end quote. So these are the impacts of investments we make. And we have, in 2023, Mr. Speaker, we've launched BC's Cancer Care Plan, which outlines the key actions of our government's will to take meaningfully reduce cancer rates and improve patient health outcomes in the next 10 years. We're expanding on the initial $440 million investment announced in 2023 through Budget 2024 and investing additional $270 million in ensuring that patients get the health care and supports they need. As many talked about, the HPV cervical cancer screening program. Self-screening does remove many barriers and obstacles, such as cultural barriers, history of trauma, the need for transportation, childcare, and booking time off work, and traditional testing. BC is now the first province or territory in Canada to offer a cervix self-screening option, and one of the first province or territories to transition to HPV testing for cervical cancer screening. Breast cancer screening improvements are an important area of women's health, which is why BC's Cancer Care Plan includes commitment to expand breast care, brachytherapy, and interprovincial planning for proton therapy. It's reassuring to hear all members of this House talking about this. I still remember encouraging remarks from the member from West Vancouver, Capilano, to our BC NDP government's former premier during 2022 UBCM in Whistler after an event, and during the introduction of newly elected member from South Surrey, where member thanked Premier's investments and support for the BC Cancer Agency and how grateful she was to get the great care during her journey, which is also commendable. And we'll talk about, of course, we're the first province to cover the contraceptives. And we get so many positive messages. But I want to share a message from Savannah, who also very encouraged and sent me a message saying, thank you for being the part of the progressive government, where I am saving $373 for my birth control prescription. And she shared this slip of her prescription. So that's the kind of work we're doing, Mr. Speaker. And women's health is more than just health. It includes mental health. It includes their well-being, keeping them safe from the violence violence and gender-based violence, and that's the work we need to do and will continue to do and will continue to make on the progress we've made so far. So thank you so much for giving me the opportunity. No.